actually it's the power of stories that get us listening and win hearts and minds over. And it really is about winning hearts over. So in the corporate world, you know, my organization exists in 4 countries. We've got 60 multinationals or so involved in creating mentally healthy workplaces. And where we always say, we say 3 prongs to our strategy. First of all, you need to socialize or normalize the agenda. So in the same way as sometimes we get caught up in the embarrassment or shame of, you know, how to talk about bowel cancer, it's part of your body that we don't talk about. Mental health, very similarly, there's so much stigma attached to being perceived as weak, people feeling like that, it, you know, if they come out and talk about it, that have negative consequences. So completely different lenses of shame and anxiety about what the response might be, but very similar feelings. And so it started with stories and socializing and normalizing that, and actually, you know, being able to say, use words, say, have the language to talk about this means that we're demonstrating to each other how to talk about it, because human beings learn from observing, and actually that's really important. Then it's about skilling up, and that's you know, the strategy that we apply is everybody needs to be able to have a how are you conversation. So it's not just about skilling up on the facts, but it's about how do we stop and listen with our hearts. And the statistics that Dr. Rashid just presented speak for themselves, particularly around young people, for example. So one of the areas that the corporate world has really lens on is focusing on raising awareness amongst young people, so that not only they are more aware, but actually they become better leaders when it comes to them. Well, they are the future. So it's about skilling up, recognizing what points where there are multiple stressors, leaning in and going, okay, what can we do to skill up this group of people in a particular way? And then the third thing is about sustaining that. So whether that's sustaining it for yourself, what is my own well-being toolkit, and we can talk about that in a minute, but actually sustaining that change within the organization. So it's not just a red trouser day thing, it's a continuous conversation throughout the year, throughout health initiatives within the workplace. So those are the 3 things I think that we can learn from the corporate world: storytelling, skilling up, education, and then actually how do they sustain that change? It's not a one-day thing, it's a regular communication thing.
Absolutely. I just wanted to pick up on that stigma piece as well, because I think, you know, certainly men especially, the stigma attached to bowel cancer is probably similar to that stigma that we're trying to break down in the mental health conversation. Just wanted to touch on why it's so important, that conversational piece that you touched on, to try and break down that stigma, because I know, you know, from the stats and from talking to Paul, it's certainly not, you know, with men especially, it's quite an issue.
So, Chris, I'm going to actually turn that question to you. So as a bloke, tell me why you think it's important that you guys should speak up, why you should expect to be heard, and what stops you doing that?
Well, I think certainly from a mental health perspective, from my own experience, I think you know, looking back, I think it was quite difficult to speak up around mental health. I think there was a stigma attached. We had that sort of macho environment where, you know, a man is not supposed to show his feelings, and that was certainly the upbringing that I had. So so I think, you know, what I've learned is by speaking up and by sharing how I feel, and, you know, expressing myself far more with friends and family, it makes me feel a lot more lighter, and it makes me feel as though I can cope with the situation. So speaking up has certainly helped me, and I think, you know, certainly on the cancer diagnosis as well, I think that support mechanism around you is really important.
Chris, that's Fantastic, and thank you for sharing so much of you in that response. I think the other thing about it is what we've just heard Dr. Rashid say in terms of early diagnosis. So if we don't recognize, whatever gender, if we don't recognize our own personal early warning signs, if we don't know what the symptoms are that we should be looking for, how do you even speak up? What do you speak up about? And I think that is so important, isn't it? Because it's not just about when you've got a long-term health condition or a serious health condition like cancer, and you're about to, you've just got the diagnosis, or you don't even know that you're unwell and you're worrying about these things, but actually we're so good at just putting them off, or that's something else, and I think in the current climate as well, with so much information on our fingertips, on the internet, we can sort of go down a rabbit hole and find, imagine things that are catastrophic. But actually, if the really important thing is, whether it's mental health issues or any other health issue, in order to aid your recovery, we have to pick up our early warning signs and then seek help. But we also have to expect to be heard by our consultants, our doctors, who our medical, our health system. And I think within that is that peer bit as well, because I guess, where do we get most of our comfort from? It's usually within our friendship network. It's usually within our peer group at work, etc., the people that we spend a lot of time with. And I think that then puts the responsibility on so me as a listener, to you as to Chris, to be able to say, look, Chris, here's things that I'm noticing about you that aren't right, all right, or that I feel are different to what you normally are. What's going on for you? And that is allyship. So I guess there's something about being expected to be heard and not judged, being expected to be heard by the health system and put through the right processes so that you can diminish someone's worries. That's compassion. And then there's something about, self-awareness, to be able to go, look, my health is really important and I'm going to get this checked out.
Yeah, and I think just picking up on some specifics, when we were chatting a couple of weeks ago, we created our new word called scanxiety, which having spoken to Paul and many others in the Red Trouser Day group, that feeling that you get when you have to go for that scan to see how the treatment has worked, and that build up of anxiety that comes for most people, I'm sure, and just some little tips that we could share that might help people through that process.
Yeah, absolutely, Chris. So I think the number one support factor we know is peer support, and Dr. Rashid touched on that. When we meet other people, when we form communities like this, and this is why I love Red Trouser. Well, I love this organization, is the peer support that it brings, because actually when we can have empathy, be listened to with empathy and compassion, we can then, that alleviates a lot of stress, and especially if that comes from somebody that knows what it's like, somebody that's been through it themselves. So that's and I'll give you a really small example, Chris, and do keep me to time, because I don't want Dr. Rashid's reputation. Asians are known for being late on everything, so I'm not going to uphold that stereotype. But look, I've got a long-term health condition that I live with, and I remember only 2 days ago, my GP phoned me. And as soon as I picked up, as soon as I saw it was the doctor's number, my heart started palpitating. And I've lived with this for 10 years, so it's not, but it takes me back. The triggers of that call takes me back to my diagnosis, when I didn't know what was going wrong with me. I thought I was dying. I didn't know what was going to happen. So that uncertainty that I felt back then is triggered every time I get a call from my doctor. And my white blood cells were low in count and all of this stuff, but actually it's all fine. But what I recognize in that word that we created is that, what did I need at that point in time? And it immediately draws me to picking up the phone to someone else with my condition that I've made friends with, to just go, God, this happened today, and have you had that before, and what does that mean? And so I think peer support is really important. recognizing our feelings quite, and again, going back to do men talk, actually, do we all have enough words in our emotional language? I really want you to think about that. Like, how often do we start a sentence with I think? And how often do we start a sentence with I feel? And then when you say I feel, can you just write down a list of what that means? Angry, sad, upset, tearful, afraid. Like, we need to develop our emotional language to be able to recognize and, label what we're feeling. And when we acknowledge our feelings, that anxiety diminishes just a little bit, because most of the time we're just pushing it down. And for me, that comes in the form of writing it down if I haven't got time to call someone or the right person, because again, that's the other thing. It's got to be trusted relationships and trusted conversations. And sometimes that's with my consultant, who is amazing, and other times that's with my friends. So I think it's and then being able to say I feel all of these things and being heard is enough. And like I said, if I can't find someone to speak to, I write it down, because for me, that's me listening to me, because I've stopped and taken 2 minutes to write down how I feel. So I think those are a couple of things that we can do to relieve our anxiety and the triggers that we have. And sometimes, yeah, and so I'll stop there. Otherwise,
No, I think you're absolutely right. And when I first talked to Paul about Red Trouser Day, I mean, I don't personally have any direct connection to bowel cancer, but I was really struck with that community that Paul and the team had built up, and really supporting each other, which I thought, which was why I was attracted to it, alongside the raising the money and the research. I just feel that there's a really strong community here that are supporting each other, and that's really powerful. So we are running out of time, so I'm going to just touch on one last point, and try and keep it on time. So Dr. Rashid said earlier about the language that staff are using. You know, sometimes that diagnosis is a bit scripted. You know, how can we bring in that more compassionate language to the clinician to patient, and really, you know, support the mental health of the patient through compassionate language?
So, Chris, I'm going to keep this one really short, because I do think we should say something about family, but I can't put it better than Dr. Rashid put it. I mean, goodness, you know, like, who am I to cast a shadow on the health profession, but actually someone from the inside going, we don't know how to have compassionate conversations always, and we need to learn that. And I think what I'd say is just one message, really. Whose agenda are you serving? And actually holding hope for that person when they are really struggling to digest all of this information is probably the number one thing you can do. So whatever you're communicating, recognizing that you have to hold that person's hope in that period of time that they're with you, because so much is going on, as Dr. Rashid described.
And we're going to touch on family. So I shall leave you to finish off with the importance of family, and why there's such an important support during this time.
Yeah, absolutely. And I think there's a real look, you know, there's been about 3 times I think I've reached out to Paul and gone, a family member or a friend of mine is going through a cancer diagnosis, will you pick up the phone to them? And, you know, Julia and Paul, every time I've stepped up. And I think when you're going through something like this, having a family outside of your family that love you deeply and care for you and are really worried for you is really important. And that's what I think that this community does. And I hope it continues to flourish and do that. But making sure that families are brought into the picture with the right knowledge, and treating them in the same way as we are treating the patients, because often, you know, most often they are the people that are going to be at home supporting the individual and going through their own trauma and fear and anxiety of everything else that's going on. So I think family receiving support is just as important, and sometimes more important, because they've got to hold that person's hope for the immediate bit, the journey ahead. And I think we can help the health system, health professionals, we can help bring people together in a way during these times, and we shouldn't miss that opportunity.